Aliaga from Cavite State University Main Campus, and I will be your student nurse for today. So, kayo po si
Angeline po.
Angeline po. So, ilang taon na po kayo?
12 po.
12. Kailan po ang birthday niyo po, ma'am?
November 19 po.
November 19, ano po?
2008 po.
Thank you po. So, ano pong gusto niyo pong itago po sa inyo?
Angeline na lang po.
Miss Angeline. So, today po is, we will be going to assess your female genitalia so that we will see kung meron po bang mga abnormality sa private part niyo po. So, I assume that you are not comfortable with us being alone in this room po. So, meron po tayong witness, your mother po, so that medyo maging comfortable po tayo. Ano po? So, I provided you a cover po, ma'am, so that we will only expose the area that I will assess po. Ito po, pwede nyo po ito gamitin. So, lalabas po muna ako para po makapagpalit po kayo. And, kung okay lang po, pakitanggal na lang din po ng inyong damit po and your underwears po. Is that okay with you po, ma'am?
Okay po.
Okay, so, and this assessment requires me to touch you po, ma'am. Is that okay with you din po?
Opo.
Okay, thank you po. So, labas po muna ako po, ha.
Sige po.
So, first, ma'am, is I'm going to ask you a slight questions po. So, kailan po kayo nagkaroon ng menstruation po, ma'am?
Last week lang po.
Last week po. So, wala po kayo ngayon?
Wala po.
Okay, that's good po. So, meron po ba kayong mga na-feel na any abnormalities in your private parts po, ganun? Or yung mga pamamaga po, kung minsan po masakit po ba, ganun?
Wala naman po.
Wala naman po. So, meron po ba kayong problems in urination po?
Wala po.
Wala rin po. Sa bowel movements niyo po, ma'am, nahirapan po ba kayong dumumi, ganun po?
Hindi naman po.
Ay, hindi rin po. That's good po. Wait lang po, ha. Okay, ma'am. So, first is, we will going to inspect the mons pubis po. Here po. Okay, so, titingnan po natin ang distribution po ng inyong pubic hair. So, commonly po, or usually po, ang pubic hair po is distributed triangular po. So, I can see that your pubic hair is evenly distributed po, and it's color black, and also, there is no presence of infestation po. Okay, so wala rin po siyang signs ng may mga parasites po. Meron po kasi usually mga parasites sa ibang pubic hair from other patients po. Siguro po that's because of the abnormalities present in their genitals po, no? Okay, so wala naman po tayo nakita sa inyong pubic hair. So next po is we will inspect your labia majora and the perineum. So this is the labia majora. This one po. Okay, so wala naman pong lesions na present and hindi rin po siya nagsiswell. And I can see that your labia majora is equal to each other po. Symmetric po siya to each other. And also your perineum po. Nakikita ko po na smooth po ang inyong perineum. Next po is we will inspect your labia minora, the clitoris, and the rectal meatus, and also your vaginal opening. So, the labia minora is the layer after your labia majora. So, para makita po natin yung labia minora niya is separate po natin ang inyo pong dalawang labia majora, which is this. So, okay. Ganun po. So, this is your labia minora. Okay. So, hindi naman po siya nagsuswell. And wala rin pong presence ng lesions. And I can see that your labia minora is also symmetric to each other. Color pink din siya and moist. And then, your clitoris, which is here. Okay. So, hindi rin po siya nagsuswell. And the size of your clitoris is normal at your age po, ma'am. And then your urethral meatus, which is here po, okay? So, nag-moist din po siya like your labia minora. And then next is the vaginal opening po here. Okay, so it is present po below the rectal meatus po, and that's normal po ma'am, that's good. Okay, next po is we will palpate the Bartholin glands po. Bartholin glands is here po, dito. Okay, so ito po. Does it hurt po ma'am?
Hindi po.
Okay, so I can feel that it is soft and non-tender, and also it is drainage free po. Okay, next is we will palpate the urethra po. Okay, the urethra po ma'am is here. Does it hurt po ma'am?
Hindi naman po.
Okay, so I can feel that it is soft and non-tender po, and also it is not swelling din po ma'am. Okay, so next is we will inspect your internal genitalia po ma'am. The vaginal opening, yung ganun po. Okay, so first is we will warm my gloved hands po. Wait lang po. Okay ma'am, so I already warmed my gloved hands po. So I will going to insert my finger into your vagina po. Is that okay with you ma'am?
Okay po.
Okay po. So here. Okay, so since you're only 12, your vaginal opening is makipot pa po, no? And then your vagina feels moist din po, ma'am. And then next is we will assess your vaginal musculature po. Okay. Insert po ulit natin, ma'am. Then I'll let you squeeze my hand po, ma'am. Okay. Okay, so when you are able to squeeze around my finger, that's the normal finding spot with this. And then we will separate your labia minora po. Twist two. And then may I ask you ma'am to bear down. Okay. So, wala po tayong nafe-feel na urinary discharge here po. And then also, there is no bulging or masses po. The next is, we will assess your vagina po by performing or by using this speculum po, ma'am. Will that be okay with you po?
Opo.
Okay, so we will insert a speculum in your vagina po, and this will hurt a little po, ma'am. Okay, first is the speculum we will use is based on the size of your vaginal opening. Okay, so I used a stapler as an improvised speculum. Okay, so I can see, you can slightly see your cervix po, ma'am. And it looks smooth, pink, and also it is positioned midline po. Okay, so also we will get this. Para po makakuha po tayo ng cervical secretions niyo po. So, as I can see po, the cervical secretions of your vagina po is clear and white. Okay. Okay, unlock po natin ang speculum. Okay. as we can see, your vagina is pink and moist po. It is also smooth and free of lesions and swelling. Okay, so thank you so much, ma'am. Next is we will perform the bimanual examination. Okay, placing my non-dominant hand into your lower abdomen. Here. First is I will going to put a sergi lube in my gloves. I use this as a improvised or as a substitute for the sergi lube. Okay, then we will going to insert a lubricated index and middle fingers po. I am waiting for the vaginal opening to relax. Okay. So, I can feel that your cervix is firm, soft, and also rounded. Your uterus is in the upper end and somehow round, firm, and also smooth po. Also, okay, so I can slightly feel your ovaries, and it is almond shaped po. Okay, so next is we will inspect. First is I will going to change this glove in my hand. Okay. Next is we will perform the rectovaginal examination, ma'am. Okay, so I changed my gloves. Also, we will put this sergi lube in my index finger and into my middle finger, because we will also insert these fingers in your vaginal opening. And may I ask you, ma'am, to bear down. Okay, I will insert my middle finger into your rectum while I was pushing your abdominal wall. So I can feel that this is smooth. Also, it is movable and firm. Okay. Thank you so much, ma'am. So next is we will assess your anus and the perineal area. May I ask you, ma'am, to turn around po. Okay, like this. Thank you so much po. Okay. So, as I can see, okay, your anus is hairless. It is also moist and tightly closed. And there is also no presence of swelling and lesions po. Okay, so next is we will inspect your sacrococcygeal area. Here. Also, it is smooth and free of redness or swelling. Okay, next is, can you do a Valsalva maneuver po, ma'am, by breathing with your nose po, with your, with your mouth closed, and then pakilagyan na lang po pakiilagay na lang po yung kamay nyo sa inyo pong dalawang nostrils, so that yung air po natin is medyo lalabas po sa inyong ears. Okay? Would that be okay po, ma'am?
Apo.
Thank you po. Okay. Okay. Thank you. Okay, so as I can see, there's no bulging or masses and lesions po, ma'am, while you're doing the Valsalva maneuver. Next is we will palpate for the anal sphincter tone. Okay, so sphincter. Does it hurt po, ma'am?
Hindi po.
Okay. Okay. So, I can feel that your sphincter relaxed, and since I can insert my finger, then this is normal po. And then, it is free of nodules po, ma'am. Okay, next is we will inspect your rectum. First is I will going to palpate your rectal mucosa for tenderness. Okay, so it is soft, smooth, and non-tender. Also, it is free of nodules. Also, I will going to palpate your peritoneal cavity. It is also smooth and non-tender. Okay, so next is we will get some or a piece of your stool so that we will inspect if there is a presence of blood in your stool. Okay, so I can feel, and I can see that your stool is semi-fluid and it is free of blood. Okay, so you can turn around na po ulit, ma'am. Okay, so thank you very much for your cooperation. And then, I therefore conclude that upon assessing your female genitalia, there is no, I don't see anything abnormal with your genitals. And then, thank you for your cooperation, ma'am, and I assure you 100% privacy since the findings of this assessment will only be present with you, only with you. And then, thank you, ma'am, and I will surely document your findings po. Thank you for participation po.
Thank you din po.